Dr. Tina Fournier, EDD, is an educator, wellness advocate, and health promotion professional with more than 30 years of experience in helping individuals and communities achieve healthier, more balanced lives. She serves as a professor at the University of Findlay, where she teaches health and wellness courses, mentors future health professionals, and specialises in wellness education, prevention programming, and positive youth development. Dr. Fournier is also an author and speaker dedicated to empowering people of all ages through evidence-based wellness practices that support lifelong health and well-being. Disclaimer: any of the guidance offered by the podcast host, myself, or the podcast guests is our own guidance. We are not liable for any of the actions the podcast listener decides to do. Welcome to the show today, Dr. Fournier. Glad to have you on.
Thank you. It's great to be here.
Absolutely. So I'd love to hear, really, when I hear someone who's got a big drive around helping people with wellness, you're a wellness advocate, a health promotion professional, you're doing all these things. I'd love to hear where your drive comes from that to really help people in that aspect.
Really, it comes from just being dedicated to help increase overall wellness in individuals so that they can live a long, healthy life. And I mean, not just live a long life, but to live life and enjoy life and being able to enjoy those things that they like to do instead of living with disease or pain and things like that. So it really comes from just wanting people to be able to live longevity of life and not just live life.
Live a long longevity, good quality of life. What do you think in this day and age? I know there could be a few things kind of blocks people from having that level of wellness.
Some of the things I think is just a big thing that I'm a big advocate of is healthy eating. And I don't think that a lot of people learn healthy eating habits at a younger age. So my focus is really trying to reach out to younger individuals, children and teens, to educate them on what healthy eating should look like and not just some of the fads that are out there about eating habits. And so I just really think a balanced lifestyle comes down to it, as well as, not going to one extreme to the other, but just having that balance in life as far as your physical aspects, your mental health, and just having balance.
Just having balance. Healthy eating. Do you think that's a challenge for a lot of us? I think you touched on that.
I do. I think, there's a lot of misconceptions about what healthy eating looks like in a lot of individuals. So um, I think a lot of, I'm not saying that, a professional on diet and health, but I do feel for, myself that sometimes certain foods can cause um, certain like inflammation in the body or things like that. And if people have like irritants or allergies or just some resistance towards certain foods, then it might cause, arthritis, or it might cause inflammation in the body. And so just learning how to address certain things that arise with healthy eating, I think is helpful to know and to learn about.
What would you and you're obviously a wellness you big fan of wellness. How would you define wellness for you in terms of what you would you say it is?
Wellness is, again, that overall balance in life. So looking at, your physical aspects, um, physical health, your mental health, your emotional health, um, your social and your spiritual health. So those are the five things that I focus on as far as wellness. Some books have 8 to 7 dimensions of wellness, but the five that I focus on are the spiritual, social, emotional, mental, and physical aspects. So I think if you have those five in sort of a balance, and that looks different for everyone. I think some people may need more of a physical aspect in their balance and well-being than others. And I think that's like the balance and overall aspects of all those dimensions of wellness help give people that health and healthy lifestyle.
I like those five you touched on there, and be really great to kind of go through them like individually. I feel like we touched a little bit on the physical with what you're talking about with like the eating.
Right.
What's the difference between the mental and the emotional for you?
um I think like the mental wellness is focusing more on like your cognitive, like your learning skills and learning new things, and like then the emotional would focus more on like your emotional expressions, your ability to understand feelings, and managing like your emotional reactions.
Got you. Okay, yeah, that makes sense. The cognitive versus the emotional. Is there anything you found like useful with the mental to to kind of like keep you sharp or kind of keep that in particular? I just love to hear it from what you found useful on the mental side.
So what like are you asking like what are some of the things you can do to practice like mental wellness?
Yeah, just like some of the tools. I know there's a huge range, but just like any particular ones you found useful.
Yeah, reading, reading books and just engaging in like things that are challenging to your brain. Like as you get older, we tend to not want to or not have that opportunity to learn new things, right? I think just engaging in learning new hobbies or learning new skills help build that mental aspect.
Learning new skills, I love it. Yeah, definitely can feel when I learn something new, it's like brain's expanding, but in a good way, even if it's
Right.
a little bit of stress in the short term, but then it's beneficial in the long term. You mentioned about spiritual health as well. The
Yeah.
spiritual's a word that's used quite a lot, but differently for people. So I'd love to know what spiritual health is in this context.
Yeah. So the way like I define spiritual wellness involves like finding meaning in something or a purpose or value or some type of connection with something that's greater than yourself, right? So it doesn't always have to, spiritual doesn't always have to mean religion, right? And
Sure.
that's when we hear that word spiritual, we always kind of go to or assume we're talking about religion, and it doesn't always have to mean that. Of course, with some people, um, that is their spiritual wellness, is their religion, which is, that's their choice.
So yeah, I like how you said it doesn't always have to mean religion. It can do, but it could be different for different people. But you also touched on purpose and or kind of something meaningful to the person as well.
Right. So just, I mean, just like spending time in reflection and um, just some, like I said, some people spend time in prayer. So it could be just spending time in nature or just whatever the individual feels like that they're connecting with another like part of their wellness aspect and something that's greater than themselves, right?
Mm, I like that. Okay, yeah, just wider than themselves and something deeper.
Right.
Finding that. Um, yeah, you mentioned about the social one as well. Is that kind of just like the interaction with people?
Yeah, build not just interaction. So I look at social wellness as being able to create or maintain like positive relationships,
Mm,
um, and just connecting with others. Not necessarily when we think of social, we always think of going out, right? Being around a lot of people. And I mean, I don't think that's the connection with social wellness. I think it's just being able to build relationship with other people and maintaining those relationships in a healthy way, so I don't think it's necessarily just being around a lot of people as far as being social. I mean, I think, there's a connection with even like the community of volunteering. I mean, that's a social aspect of wellness is, connecting to the community as well as with volunteering and um, making those connections with others.
mm, okay, yeah, not just being around other people. I like that.
Yeah.
With kind of like wellness and people really like wanting to work on their health and maybe one or multiple of these areas, there can be quite a lot of information out there, and sometimes people can feel, I know I have, feel a bit overwhelmed by that, how much guidance there is out there. How can someone begin to kind of like start on improving their health and well-being when there's just like so much information?
Right, right. One big thing that I always teach in all of my classes or when I'm speaking is that wellness is a true balance of life, right? And small, consistent actions have the most impact in your life. So, whether you're trying to change your eating habits, so the small changes, right? Or whether you're trying to be more social, the small interactions that you make with individuals can have a greater impact than dramatic changes. And that's like for each dimension that I talk about, I always say start small.
Mm,
If you feel like you don't really have any like social aspects in your health and wellness, then start small. Start by volunteering, or start by making one new friend. So I think by incorporating like habits that support all the dimensions of wellness and trying to find one small aspect to address in each of those dimensions.
mm,
And like we don't have to practice each dimension every day, right?
mm,
It's an overall lifetime balance that we try to find in wellness. So I think the big thing is just start small and be consistent, and those have the bigger impacts than just trying to make drastic changes all at once.
mm. Small, yeah, small little changes. I like that. Um,
Yeah.
and you said they don't have to be all in the day, like all five areas in a day. Just kind of,
Right.
yeah, I like that. I know you do. I mentioned at the start you do like prevention programming as well. What's kind of prevention program? Your prevention programs?
So I did my dissertation on, and I researched on substance abuse prevention, and I specifically focused on looking at how we can improve, or what positive factors should we implement into those substance abuse prevention programs that we use in our middle school and high schools.
Mm,
And so that's like, I did my dissertation on that, and interviewed like the substance abuse prevention programs that are out in the community. And then I interviewed health education teachers, counselors, and intervention specialists in middle school and high schools to kind of get, an idea of what they thought we should add and what they thought worked and didn't work, basically.
mm. I got you. Yeah, substance abuse. I know that can be a big challenge for um, many places, and you touch on like education. You've touched on it a lot. Um, yeah, so
Yeah.
I'm glad you're getting those programs out there on that one.
Yeah.
Yeah. So yeah, the like it with like substance abuse. Do you find is it linked to any of the five areas and just a tool that you touched on? Is it kind of like maybe an absence in any of those areas?
Um, One big thing, I know, like just doing my research, that a lot of people I interviewed touched on the social, emotional aspect of middle school and high school students,
Mm,
that they really lack a lot of those skills, the social and emotional skills. And sometimes, we read about research and about substance abuse, and how sometimes that could be linked to why individuals choose to use substances. So that was one thing I did find was, that in my research, that the addressing social emotional health and trying to improve social emotional health in middle school, high school students, they, like the individuals I interviewed, thought that that would help improve substance abuse. So
that's interesting. The social and emotional part. Yeah.
yeah.
Oh wow. Yeah, sounds like you've got a lot of passion behind like wellness. Has that been from like a young age?
um I've always been involved in like sports when I was younger, and then through college, I um my undergraduate was in health and physical education.
Mm,
Always been passionate about health and and physical education. So then, my master's was in wellness and health promotion, and then I did my doctorate in education. So it kind of like snowballed from, I guess, from when I was younger. But yeah.
mm. And do you find when you're kind of like teaching it and sharing it, people are quite receptive to like improving their health and wellness, or do you get met with resistance sometimes?
Um, I've never really been met with resistance.
Mm,
But, I mean, you can definitely tell the individuals who are not really interested, right?
sure.
But no one's ever come up and said, I don't agree with anything you're saying. um, but you can tell individuals that really, I guess, they don't want any part of it, or they just don't want to listen, and which is fine if
Got you. No, that makes sense. Yeah, I'm glad. Yeah, people were generally like receptive to it. And I like the model. You got the five dimensions as well, which is really good. I know. Yeah, like the physical one we touched on You touched on like food a bit. Um, and do you find these five dimensions they can kind of like interlink, sort of overlap a lot as well?
On some parts,
Okay.
yeah, definitely, because you have, like, one physical aspect is getting enough sleep. Well, that affects your mental health, right? If you don't get enough sleep, that affects your mental health. It could affect your emotional health. If you don't get enough sleep, it could affect how you interact with other people. So it's, yeah, I definitely overlap in some aspects.
Yeah. Okay. No, that makes sense.
Yeah.
Um, I'd love to know, as we kind of like wrap up today, where is the best place for people to find your work? Anything you've done, you'd like to share, and also from anything we've talked about today, or anything else you wanted to add. Is there maybe a final point you'd like to leave us with today?
Well, I have a website. It's drfournierauthor.com. That's just um, promotes the two books that I've published. They're children's wellness books. Um, you could email me at fournier@findlay.edu. That's my university email. If you would like to get more information from me, that'd be a great way to do it as well.
Oh, awesome. Yeah, we'll be sure to link those below. So grab Dr. Fournier's books, her work, and her contact information there as well. Yeah, is there any final point you'd like to leave us with today from anything you've covered?
Um, no, I think just one big thing is I truly believe that everybody needs to have balance in their life and focus, where they feel unbalanced, and just try to do small changes and not drastic things in life.
Love it. Those little changes, and you got those that five dimensions are really good. Uh, I feel really some really good like foundations to use for our wellness, our health, our
Right.
well-being.
Right.
I love that. So, Dr. Fournier's links, as I mentioned, are in the show notes below. So, grab the book, grab the work, and yeah, get in contact with Dr. Fournier. Those are all listed below. But yeah, Dr. Fournier, I want to thank you for coming on today and everything you shared.
Well, thank you. Thank you for having me.
Absolutely. So that concludes our episode for today. And remember to lead with your heart and not with fear.